think it was said that a week's a long time in politics, but this has been a really hard week for me because the amount of bullshit coming out of the Labour Party about the NHS has been it's taken its toll, and I think we need to review the whole lot because no one has really challenged anything that's been said. We've had a party political broadcast by the Labour Party, but it doesn't seem any different from when they're on the other channels. It's no one challenging them at all. So thank you for coming on, because I'm going to go through the painful process of going through what Labour have said in the past week on the media about the NHS, and then we'll hear from you, Bob. Now, the first clip I'd like to show is one that we're familiar with on Keir Starmer's part. Is he likes to talk about his family. I'm just wondering what you think about all this.
My mum worked in the NHS. My sister worked in the NHS. My wife still works in the NHS. My mum was a nurse, and a very proud nurse, and so the NHS was her livelihood. But she became very ill during her life, and it became her lifeline. And I spent a lot of time when I was growing up in and out of hospitals with my mum. My wife also works in the NHS, and my sister worked in the NHS. So the NHS, I feel, sort of runs through me.
Well, he's reiterating the same thing there, that he's got the NHS running through him. His family's all part of the NHS. Why does he keep saying this stuff?
Well, I think he's desperate. Keir Starmer is a con man, and he's using the fig leaf, the camouflage of relatives who may have worked in the NHS as some sort of credential, as a badge of honor. But what he's actually doing, his policy stance, everything he says on the NHS materially is destroying the NHS. So he's not sticking to any of the principles that his mum might have recognized. The NHS has been reformed out of all recognition from the original founding principles. So we have a very heavily marketized, bureaucratized, management-heavy NHS, which I'm sure any of his relatives who understood the founding principles would say was a good idea. So this is a desperate man with no charisma, who's betrayed all his policy pledges, wanting to pull the wool over the electorate's eyes so that they are fooled and lulled into a sense of security that he has any intention of protecting and restoring the NHS.
Yeah, he wouldn't need to say all that stuff if he really, he wouldn't need to say that if he really had planned to look after the NHS. He wouldn't need to justify his mum and his sister and all that stuff, would he?
Exactly. And, there's plenty of people working in the NHS, senior managers and administrators, who absolutely have no interest in preserving it as a public service. The senior leadership of the NHS is actively destroying it. So working in the NHS, in what capacity? He doesn't go into detail about what his wife does. But, I've met many people at senior levels in the NHS who are quite happy for it to be privatized, turned into a cash cow for multinational corporations.
Wow. I mean, we'll move on to the second part of what's been going on this week with the Labour Party media round is talking about money, and they like to say that it's all fully costed. They know what they're doing with the money. The money's all there. They can promise this and promise that, but then on other issues they're not willing to promise anything. So I'm just going to show this kind of inconsistency that goes on with those Labour people on the media.
I know we can do so much better than this. And that's why we've said that we would scrap the non-dom status and use that money to fund the next generation of doctors and nurses being trained to come into the system. That's desperately, desperately needed.
But I've got to be honest as well and say, I can't do 35% overnight. We'll do it as quickly as we can.
Over the lifetime.
You've said to us previously that 19% was unaffordable. You've said that 35% for the junior doctors was unaffordable. So you are happy sometimes to talk about numbers. So I'll ask you again, is 10% affordable?
Well, we'll set out our manifesto policies, which will be fully costed and fully funded
this is
at
a situation right
at
here,
the
right
next
now.
general election. I know, Laura, and that's why the Health Secretary should be here, but he isn't. And frankly, I'm fed up of coming on programmes and being asked how I, a Labour spokesperson would fix Conservative problems tomorrow as if I'm in government tomorrow. I'm not in government tomorrow. The Conservatives are. They're not here. They don't answer questions. They don't have a plan. And what we are doing is setting out, I think, the substantial answers the NHS needs to make sure we're not here again and again. Take our workforce plan, the biggest expansion of NHS staff in history. More doctors, more nurses, more midwives, more district nurses. Fixing the fundamental shortage of staff in the NHS so that we don't end up back here over and over again.
I feel a bit dizzy listening to him because he said at the start that he doesn't want to talk about money. Then he talks about money. And I'm thinking, I can't really get my head around this. He said he can't talk about it. Why? And then he says, why am I trying to fix the Tory problems? And then he said he's going to fix the Tory problems. It's like he's driving me insane with double talk. And as you see, Starmer was quite clear about we're going to scrap non-dom status and fund all this through that. So he has specific plans. He's quite happy to talk about that, as if there were a general election tomorrow and he was in government. It's all over the place. I mean, is that part of what they're doing? They're just trying to confuse me.
Yeah, I think that the confusion is helpful, because if the public don't understand what they're actually saying, then provides a bit of cover. So confusion is helpful for their case. But what they're not doing, what they are doing is actually logical somersaults to avoid the obvious. The current biggest problem the NHS faces is retaining staff. But what they don't want to talk about is short-term solutions, which they could spell out, but they rather talk about what they might do in 5 or 10 years' time, long enough for the public to forget the promises that they are making. But we have, there's a simple proposal on the table, is to restore the staff wages to what they should have been if there hadn't been an NHS austerity for over a decade. That would cost for junior doctors around £1 billion. And if Starmer and Streeting were sincere about protecting the NHS principles, they would say there's money available, because this money is returned to the economy. This money doesn't leave and end up in Swiss bank accounts or in tax havens, which what does happen to money which is pumped in at the top of society. So, there was billions squandered on the pandemic response. There's billions being written off in the fraud related to the pandemic, but neither of these clowns is able to address the problem facing the NHS, which is a recruitment and retention crisis happening now.
Right, exactly. They do this promise of 5-10 years, whatever, and not anything now.
Well, the other issue with this training more people, well, that fits into the university industrial complex. We have a privatized higher education system. What they are doing is saying we believe in lulling, these vocationally dedicated people into undertaking courses which will saddle them with tens of thousands of pounds worth of debt, so they'll be desperate for a job at the end of it. This is a form of exploitation. That's what they're advocating. This is a neoliberal model of training up the next generation of professionals who are saddled with debt.
Wow, I didn't think of that. Thank you for that. Now, this is another point that's been raised this week by Labour people on the media. It's something close to you, is a reform of GPs. So I'll just play you a clip of this.
I'm glad you mentioned GPs. There simply aren't enough of them, and the ones that we do have, despite their very best efforts to try and meet demand and to make more appointments available, they're just overwhelmed by the number of people seeking to get an appointment. And we've lost 2,000 doctors in recent years. Unless we increase the number of doctors, keep the great doctors that we already have, we're going to struggle to see patients seen on time. And the reason I make the argument about reform today is that one of the areas where I think we can help GPs and help patients is providing a wider range of services in the community to help patients get seen faster and also reduce demand on overstretched GPs at the same time as we are training a new generation of doctors by doubling the number of medical school places. So Labour has got a track record on this, remember. When we were in government, we delivered the shortest waiting times and the highest patient satisfaction in history. We can do it again, but it will require us to invest in the workforce and also to change the way that neighbourhood services are delivered so that patients have more choice and doctors and GPs in particular don't become the bottleneck of patients trying to access the NHS.
I met with Wes Streeting this week, and we had to agree to disagree that he doesn't understand general practice. And the GPs are one of the most efficient and effective parts of the health service in the way that they manage risk. They are superb at it.
So you don't think that Labour really understands how the GP system works?
Well, I think that they have a lot of work to do between now and an election. We have offered to help them with that. We'll do business with anyone who has the right policies. This is not about party politics.
Right, I mean, that was interesting to find. There was a clip of someone saying something critical of Labour and Wes Streeting. That was the BMA chair. Can you tell us more about what he's identifying that Streeting doesn't understand about GP practice?
Yeah, so, Streeting is putting forward a solution for the problem that successive governments have created. GPs have undergone lots of reform. One I've talked about before on your program was in 2004, where primary care was broken up into out of hours and core hours. Out of hours that was outsourced to private companies. More and more GPs have been, certainly smaller surgeries have been closed. You're getting an amalgamation of general practice. But what Wes Streeting is talking about, the reforms he's talking about, setting up more community services, well, he is signalling his agreement with the Tory government that hospital services that can be pulled out into the community, like diagnostics, and be run by private companies and allowing direct access into those private companies, for-profit companies, that's the solution he's talking about. He's talking about more fragmentation. He's talking about replacing doctors with non-doctors. So they are reading from the same script, a script written for them by the big four accountancy firms and management consultants like McKinsey, who are pushing this agenda. Tory party, Labour party are unified in the destination that they want to achieve for the NHS, which is a smashing up of general practice and a replacement with loads of, for-profit little units within the community, further fragmenting provision and destabilizing hospital imaging departments, diagnostic departments. So this is, music, this tune rings a bell, and the bell it's ringing is this exactly the same policy that Simon Stevens has spent 5 years as a former head of the NHS, has spent 7 years doing the groundwork for exactly what Streeting and Starmer are describing. The only problem is very few professionals understand what they're talking about, let alone the public. And the journalistic inquiry you refer to, which is non-existent, is crucial in a democracy for us to understand what our politicians are up to. But the journalists aren't asking any questions. So you suggested earlier party political broadcast. Well, every time they're on TV, it's like a party political broadcast. Zero challenge.
Yeah, I mean the thing about this is the Conservatives are not bothered with this at all, and it's like a fake opposition to the Conservatives. It's a fake pantomime of we want that the NHS is broken, the Tories aren't, we can't trust them, and the media are just playing that narrative all the time, and it's really frustrating to watch, isn't it?
Well, if you wanted any more evidence of how much in agreement both major parties are, I did an interview on Monday on GB News. The host was Jacob Rees-Mogg, and I was trying to explain to him what was going on in the NHS. He did all he could to talk over me, interrupted me, didn't allow me back in. And then there was a couple of other panelists in the studio with him. And many of their comments were to support the stance of West Streeting and Starmer on the NHS. Need I say more?
Yeah. Well, we got to keep getting this stuff out, because there was one interview that I found very revealing, which is Peter Kyle. I don't know why they interviewed him, but he sort of spoke too much and too enthusiastically. He's not quite as accomplished as Streeting and Starmer at selling rubbish.
And we will use another tool as well, and that is very targeted targets, specific use of targets to try and incentivize the positive change we need. Because we don't just need to fix fundamentals in terms of staffing crisis, we need to make sure that the systems in the NHS are bending towards the needs of patients. Now, targets are one tool in doing so. There's lots of other tools that we'll be using as well. Okay. Good, solid management, use of foundation trusts and so forth, and changes in governance. We'll make sure we invest in the right way in return for modernisation of practices. We'll also look at how we can use other sectors, such as the voluntary sector and the private sector, in targeted ways. These are all the tools we'll use. But yes, we will use targets too.
Wow, he said a lot there, didn't he? Targets. What's that's a very Blairite idea, isn't it? Targets. What's behind that?
Well, it's a way of setting up incentives and conditioning the professionals to behave in a certain way to achieve corporate objectives. What he's actually talking about, the targets do not serve the patients. Many of the targets have nothing to do with patient care. They often distract the clinicians from the day job. They become an end in themselves, and they can often pervert the activity of the doctor or nurse in front of the patient. So many of these targets distract us from the day job, waste a lot of time. And in order for example, hospital trusts to achieve their maximum incomes or for general practitioners to maximize their income, they are pursuing targets which do not directly, improve the care of patients, and in some cases may be harmful to patients. I'll give you an example. A few years ago, we had a target to do opportunistic screening for dementia in people over 65, so that you might have come in for one reason and your doctor or the nurse starts giving you a questionnaire to test your memory. Now, the problem with that screening tool was it had a very false positive rate, 40%. There's not very much effective treatment. Social care has been decimated. So you have to wonder, why are you doing a screening test working towards a target or a target payment, which doesn't help the patient? And in that case, potentially is harmful to the patient, falsely stigmatizing them with a diagnosis of dementia. And, in 2017, I believe it was, Theresa May got caught out for her reasoning behind this was because of the dementia tax, which she had to drop as a political policy. So we had government introducing targets on health professionals, not to serve a medical end, but to serve a political end.
Wow. And this, Kyle was talking about governance, changing governance, using voluntary and private sectors, just dropping it in there. What's he talking about there? Governance. Haven't they changed the governance enough?
Yeah, it's rhetoric, it's sophistry, it's the management speak, which may sound harmless on the surface. Who can argue with efficiency? Who can argue with monitoring and improving performance? But the reality, as a frontline doctor for the last 30 years, whenever I hear a politician talk like this, often it means wasting a lot of money that doesn't go on patient care and handing more and more of the NHS budget over to the private sector, which is not democratically accountable, which is often very obscure in terms of the funding arrangements, often are paid more than the NHS for providing the same service. And fundamentally, they are there to cream away profit for shareholders. And, even the charities that are involved, we have a very corporate charity system now, whereby you've got the heads of the charities often paid six-figure salaries. They spend millions on advertising, and they have a cuddly feel about them. But what they're doing is actually contributing to the fragmentation of the NHS, as do the private companies.